A breast augmentation is essentially either inserting an implant or adding fat also to the breast to change its shape and give it a fuller, more lifted look. Breast augmentation has a very interesting history where it first started with uh, doctors just injecting silicone directly into the breasts. And some patients had good results with that, but in general, injecting a free-floating silicone agent is a little toxic to the body, and sometimes the body can have immune reactions to it. So over time, it developed into an implant that had a shell around it and was filled with silicone oil. As those implants were in the body for many years, sometimes the shell would leak and some of the silicone oil would actually cause harm to the body. And from 1991 to 2006, all silicone implants were actually removed off the market in the United States until a newer, firmer shell and silicone gummy bear type texture on the inside was developed. And currently, our current implants that we use have this gummy bear consistency where it has a much more durable shell on the outside, and the inside has this gummy bear consistency, which is much safer for long-term use. There's many good reasons to have breast augmentation. Probably the most common ones are I was born flat-chested, my breast never developed, or women in my family just don't have proper breast development. I don't look good in clothes. Dresses don't fit me right. I hear many of those reasons, but another really good reason for breast augmentation is really having children. A lot of times when women breastfeed for a year or two, they lose a lot of volume, their breasts change shape, they get flatter, and they really just want breast augmentation to just kind of regain the look that they had before. Breast augmentation has been popular actually for several decades. I think currently more natural looking breast implants are more popular, and maybe in the 80s, kind of that Pamela Anderson, very large breasted look was popular. But I think breast augmentation will always be popular because it's a simple procedure. It makes a really big difference. It tends to make patients happy, and it's a quick recovery procedure as well. We perform well over 100 breast surgeries a year. Every month is different, but we typically will do 8 to 10 breast procedures a month. People come from all over the world for this procedure. I think we do get the majority of our patients locally here in Los Angeles and in Santa Monica. However, because Los Angeles is a very popular place for cosmetic surgery, we get people internationally all the time who are interested in breast augmentation. When a patient's looking for breast augmentation, they should be looking for expertise, knowledge in the surgery, and also looking at their work. A lot of times a surgeon's photo gallery will tell a lot about their expertise and their ability to create a really good breast augmentation result. Getting to know the surgeon, making sure their facility is accredited, making sure they have the proper certifications to do the surgery. All of these things are very important, but most important is your relationship with the surgeon, and do you get along with them? Patients who have breast augmentation surgery sometimes are a little shocked at the additional attention that they get in public. Sometimes it's almost uncomfortable because they notice that they get more attention from the opposite sex, or sometimes they fit better in clothing. They sometimes are able to show off their body a little bit more, and generally people tell me that they have a lot more self-confidence. They really enjoy their new look. When considering breast augmentation, I think there's really three main decisions that you have to make with your surgeon. The first decision is, what type of implant are you going to choose? Are you going to choose a saline implant, or are you going to choose a silicone implant? The second decision is, where are you going to put the implant? Implants are generally put above the muscle or below the muscle, and there's certain reasons for both, and that's a decision between you and your surgeon. And of course, the third most important decision in choosing breast augmentation is, where do you want the scar? So there's three main places where you can actually choose to have the breast augmentation scar. One of them is right around the areola, which is one of the most common. The second one is in the crease of the breast, which is underneath the breast in the crease. And the third scar that you can choose is in the armpit. And so in general, those are the three decisions you have to make when choosing breast augmentation surgery.